Okay, so I just want to welcome everybody here today for our webinar, Fathers Grieve Too. We're looking at dads and partners after pregnancy and infant loss and what their grieving journey looks like. So I'm Kylie Hanisch. I'm the founder of Return to Zero Hope, and I'm a bereaved parent myself. My son Norbert was stillborn back in 2005. And um, I'm really passionate about educating both parents and providers about pregnancy and infant loss and what grieving, normal grieving looks like, what we can do to help ourselves navigate this road through growth and healing after our losses. So I'm grateful to have this webinar series available. And if you're joining us live or watching this afterwards, there are many other webinars that you can watch for free on the website as well. So I encourage you to take a look. So I just want to introduce my friend and colleague, Elise Springer, and I'll just let her introduce herself.
Hi there. I'm Elise, and I'm a marriage and family therapist in Los Angeles, sitting on the RTZ Hope Clinical Advisory Panel. And I came to this work both personally and professionally. I have a real passion, as I know Kylie has mentioned, she does as well, around working with dads. And a huge piece of that is because one of the things that happened very early on was noticing how frequently men were shunted to the side in the clinical experience post loss. And I'm so glad that we get the opportunity to do this today. We're hoping to make it a little bit more of a dialogue between Kylie and I, a little bit more informal. And if I'm not mistaken, Kylie, I think the goal is that this is more for dads than for clinical providers. Is that right?
Correct. We do have a webinar on the website that is specifically for providers that goes into more, that at least taught, but it's more into the research around the mental health of dads after loss. So it's a little bit too much information, I think, for most dads. So this is more specific towards fathers. And then as we're doing this, if you have questions, you can use the chat feature and we can communicate that way. So the plan is we're going to talk for about 40 to 45 minutes, have a conversation about this, and then we'll open it up to questions at that point. But if something comes up while we're talking, I'll be paying attention to the chat box, and then we can respond to you either at that time or later on. So I think it's safe to say that there's a lack of resources and information out there for fathers and partners after loss. And within that, I think it's really important to understand paternal mental health in general, whether there is a live baby or not a live baby. And sometimes I think it's easy for people to think, well, if there's not a live baby, then none of this applies to us. And that's just so not the case. So in normal fathers, right, when you have a baby, there tends to be a flare up of paternal postnatal depression in fathers 3 to 6 months postpartum. So in moms, we might see it a little bit earlier, although it can come anytime from like 2 weeks to a year after. But in dads, there seems to be more of a flare up a little bit later. And the numbers are quite high, at least, right? That even though this is something that's not talked about, that there are dads suffering with postpartum depression, but we just don't talk about it, and they don't know what it is.
I think a lot of times too, the numbers are so hard to really quantify with dads because there isn't very much screening of dads, right? I mean, it's only been recently in some states that we're starting to have mandated screening for, childbearing parents, but there's nothing about non-childbearing. It's hard to really pinpoint the numbers here in the US.
Yeah.
Yeah.
And then looking at, I mean, so understanding that dads do get postpartum depression, and it can be up to like 1 in 4 dads. Also, there's postpartum anxiety. Like postpartum depression isn't the only thing. There's different forms of postpartum mood and anxiety disorders. And then you throw in a, a pregnancy or an infant loss or a birth trauma, and that the men have the same rates of developing PTSD as the birthing parent.
And I'll add to that again, not just postpartum depression or postpartum anxiety, sometimes, and of course PTSD, but OCD too, postpartum OCD, and postpartum bipolar disorder. So I think there's the full gamut of perinatal mental health disorders equally in men as there are as women. But again, because there are less opportunities for men to interact with providers in terms of a lot of providers don't even have education about postpartum in women, let alone in men or in birthing partners.
So I don't think we're going to cover this later, so I want to bring it up now. What does some of this look like in fathers for men to be aware of? Like, well, how do I know if it's depression, anxiety, PTSD?
Yeah, I mean, I would say that a lot of times what ends up happening is that depression, paternal depression in men might show up as irritability and anger. And I think that a lot of times this is a bit why providers don't necessarily recognize it or partners may not recognize it. Of course, in terms of trauma and PTSD, we know that that's a really common sign. So I think for the loss community, more often than not, providers may be able to make that correlation. But irritability and anger, a lot of times in paternal depression, there would be a preoccupation with work. You know, there's some correlation to that in terms of like the pressure of what it is like to be the provider. And men who have experienced loss, so often they are the outward facing parent, right? And particularly in cisgendered couples and heterosexual couples, there's a real um, pressure, I think, to be the forward facing person. And, I'm just even thinking about the panel that you did, Kylie, with our three wonderful dads most recently. And I think one of them was sort of talking about how, yes, this happened to him, but he wasn't the one physically experiencing it. And that dismissal, I think, of his own experience frequently happens. And not to say that birthing parent isn't having an immense amount of trauma. We know that they are, but men have this tendency to really dismiss their own experience and engage in sort of a stereotyped man up piece, just given their surroundings or perhaps like cultural upbringing, that there's this real intent to be the strong person in this dynamic when there has been a loss. And that just really translates to, a lot of internalized distress and isolation and loneliness. A couple of things that I see frequently that are always really interesting is that for whatever reason, I've seen an increase in car accidents in men in the first year post loss. It's not written down anywhere. It's sort of an anecdotal dynamic, but for whatever reason, I think there's something correlating there. And then we know that things like use of substance to self-medicate, sometimes use of affairs, emotional or otherwise, as a way to self-medicate, that there's not frequently an outlet for a lot of grieving dads. And again, that consistent pressure of having to be the outward facing person really has an impact.
Yeah. So when we're looking at paternal mental health, like what are things that we need to be aware of? Um, or you as a father need to be aware of what else is going on in addition to the loss. So what is your own mental health history, right? Do you have a history of depression, anxiety, bipolar disorder, OCD, that type of stuff? And then when a loss happens, that these things are just a risk factor that make the likelihood of you developing something higher. Do you have a history of trauma? You want to talk about ACE scores for a second, Elise?
Yeah, absolutely. So ACE stands for Adverse Childhood Experiences. And the origin of the Adverse Child Experiences scale is a clinician named Dr. Ferlitti. And he was a weight loss clinician a doctor in San Diego and Kaiser in the early 90s. And he was really trying to figure out what the origins of obesity were. And I'll give a little bit of trigger warning here, just in terms as I'm going through the origins of the ACE. But one of the things that he found, first of all, he always jokes that he was so excited because he had a lot of success with this obesity study, and that's the words that he used. He actually was terming it obesity, and he jokes, well, I knew I was going to be famous because I had great success and people had immense amount of weight loss. And this was clinical obesity, 100, 200, 300 pounds. And however, one by one, everyone began to drop out of the study and regain the weight. And as he likes to talk about it, he said, well, there went all my dreams of being in journals. So of course, like any good sort of study, he went to all of his participants and tried to ask what happened that created this regain of the weight, because many of the participants in the study regained the significant amount of weight that he had helped them lose. And he reached out to one of his participants and said, okay, we're going to go through all of the criteria. For example, how much did you weigh when you first had sex? And the participant said 45 pounds. And Dr. Ferlitti said, I'm so sorry, I think you misunderstood me. How much did you weigh when you first had sex? And she said 45 pounds and burst into tears. So she had been victimized at a very young age. Dr. Ferlitti said, is this the correlation? Is this exactly what it is? Is this all victimization? And of course, what he determined is no, it's not just victimization, but sexual victimization was one of 10 adverse childhood experiences that correlated to both physical and mental health concerns later in life. So 5 personal, 5 community, different dynamics that really was everything linked to depression, to hypertension, to even substance abuse and lung cancer. Most people have between 3 and 4 adverse childhood experiences, but after 4 adverse childhood experiences, it really increases the risk of both a mental health concern and then physical concern. And Dr. Ferlitti says, just like when we go to our providers as we age and we get our cholesterol, we can then mitigate our cholesterol. We can do things to help us become more healthy. So he says, same thing with the Adverse Childhood Experiences survey. If you have a higher score and you're self-aware about it, you have the opportunity to mitigate it. You have the opportunity to kind of navigate through it, some of that obviously with therapy, and just equally that there's resilience. So that's sort of the brief piece of it. The Adverse Childhood Experiences survey is free to take online, so of course it's something that you can look up for yourself and have the opportunity to understand how it might impact you. And a piece of that is that with every loss begets loss. So if you do have an adverse childhood experiences, your perinatal loss pregnancy loss, infant loss would correlate a little bit to all of that family of origin dynamic. And I will add one other thing that I always find really interesting is for men with paternal depression, there is a correlation between a overprotective family of origin and paternal depression in men. And I always like to think about this in terms of what kinds of adverse childhood experiences or loss or family trauma kind of increase that overprotectiveness. But I always found that to be really interesting, that there's a correlation between an overprotective family of origin and paternal depression. So we've got so many different channels, I think, that lead to the risk factors of paternal mental health.
Yeah. And then I think also within the family of origin, like the mental health of your family of origin, like maybe you don't have your own mental health history, but maybe family members do. And that's something to be aware of as well. And then your partner's perinatal experience, like I think that's referring to, is the situation perceived as traumatic? And um, and with trauma in a birthing experience, it's important to understand here that the trauma isn't something that's deemed traumatic by the provider. It's how the birthing parent experiences an event. And if they think it's traumatic, that it is. It's subjective to the person. So that also has an impact. And then I love this stuff. I think it's so interesting looking at hormones in men when, their partner is pregnant. And Elise is more of an expert on this than I am, but looking at the hormonal changes that happen during pregnancy.
So yeah, this is really interesting. I think we're just now beginning to understand the interplay between hormones and mental health in men. I mean, of course, we know there's not even very much credence to it with women more often than not, but there are specific hormones, including testosterone and estrogen, progesterone, oxytocin. These all sort of kind of fluctuate when a dad is living with a pregnant parent, meaning so all of this actual estrogen is correlating when we're living with a gestating parent. And I think some of that, like the easiest way to explain it is, we know that gut health, for example, and households that are cohabitating, households often have very similar gut health, right? So similarly, in birthing parents, their hormones are fluctuating and changing, and there is a correlation with their partner who's there with them, right? So we don't quite have the mechanism yet, but one dad's estrogen might increase in that month before a birth. We think that the purpose of that is bonding, because we know that there's many hormones that lead to a parent bonding with a child. And so this is sort of one of those moments where we don't give any credence to, well, what happens with mental health when estrogen is rising and testosterone drops. And for some of that, we know that it influences both affect, like how expression and interaction with baby. We know that, for example, when a non-birthing parent is at work, and a male non-birthing parent is at work, their testosterone will be higher. And then at home, their testosterone will be lower. And of course, there's some other correlation between crying babies and what this means for playfulness and how this manifests in postpartum depression. And I would encourage you, if you're more interested, there's more of this, I think, in the clinician webinar that we did. But near off, just to say, being aware that there are some dynamics here at play that can increase irritability or increase depression. And they're not just this manifestation of dads being kind of a jerk, which frankly I think is what happens. There's sometimes this uh, belief on both partners and providers' behavior around the perinatal period for dads that is just really like putting dads in a negative light and giving no credence at all to the hormonal health. So again, this is sort of a new area of research, but one to just be aware of. And all of this to say that more often than not, this is where things are very unbalanced. We barely have support for moms. We have very little for dads. And then again, that irritability and anger, which is so common in paternal depression, really gets labeled in a different way. It's not correlated to the mental health in the way that it probably should be by both providers and partners.
And then looking at expectations of fatherhood, like what are the pressures put on dads that can be contributing to the depression and anxiety? So, right. So there's like the financial pressure to provide for the family. In most companies or in organizations, you have limited time off to
Well,
stay home.
I'm just thinking about this, right? Because wasn't there recently a state that had some bereavement leave? Wasn't there state legislation passed recently where there was some bereavement leave? I remember seeing it because I was
Yes. I
thinking,
don't remember who though.
but I was just thinking how rare that is, right? And so and there's so much more, when we look at lost parents who are birthing parents, moms, for example, there's a very physical, obvious, if there's a later term pregnancy loss that, you know, more sort of social acceptance of taking some kind of bereavement leave, right? But more frequently for non gestating partners or dads, there isn't the same sort of more obvious example, clearly. But because of that, there's even less sort of here have the opportunity to grieve, right? It's a little bit, I think, frequently I hear that companies or coworkers or bosses kind of indicate, well, it wasn't you. So, fine, have a couple of days off to caretake for your partner, but like then get back to business as usual, so to speak. And that I think is another way in which that pressure can feel so constricting, right? That pressure from partner at home, like, why aren't you here? I need you. We're grieving this loss together. Why aren't you grieving in the same way that I'm grieving? Like, how can you go back to work? Why can't you just tell them that you need this time off? And cisgender dad or dad may be saying like, look, I don't have this luxury. I'm being expected to go back. I don't want to lose our job. Like, we need this. Like, there's so much of that pressure, I think, that goes on between couples, and just not any acceptance, really. We barely have paternity leave at all, so bereavement leave is even less frequently an option for dads. And I think that really, again, creates this whole cultural expectation of like, well, yes, this is a tragedy, but also put your feelings aside, get through it, man up, be strong, kind of thing.
Yeah. And we're going to talk a little bit more about that, like the delayed grieving, the reasons why. But in all of this, I think that there's the expectation that the dads are going to have to take care of everything else and other children, and that there's less focus on taking care of themselves in this process of whether you have a live baby or you have a baby that died. That there's a lot more responsibilities put onto you. So looking at delayed grief. So there is oftentimes in fathers delayed grief or the delayed expression of grief. So it's not necessarily that they're not grieving in the beginning. It's just that they don't have the opportunity or the time or space to express their grief. So, as we mentioned, like the focus is usually on the mother or the birthing parent who's carried the baby, and had the loss. And so, as Elise mentioned before, like he will be the communicator between her and their family and friends. So he has to filter things coming in, express things going out. Like people are asking, what do you need? What can I do? Oh, can I even, asking like, asking the dad, well, we're pregnant and I don't know if your wife, whoever her name is, I don't know if we should tell your wife, not being aware that he lost a child also, but he's having to serve as that kind of boundary and protector of her. And then there's society in general, the lack of recognition that the father is grieving also, that he isn't the one who carried the baby, and that somehow diminishes his right to grieve.
And I will say I find this actually between couples sometimes too, right? That there can often be this resentment, I think this externalizing of birthing parent or mom's own distress and grief and anger.
Mm.
And I think, partner and dad often are the recipient of that externalized anger and grief because not only did he not carry, he's not going through the sort of physical reminders in the same way that birthing parent or mom is. And again, how to kind of sometimes I think dads actually take that on and agree with it, and a lot of that is just because of the reflection in society that that's the case, and also too because it's like needing to be aware, and most dads are aware that so much of this anger is birthing parent or mom's distress, but there's a real wanting to hold her and just accept you're right. I don't have these physical reminders. I'm not continuing to, for example, even like lactating after loss or having discharge after loss or all of that sort of physical reminders that mom or birthing parent are having. And then again, just because of that, feeling like I don't have the right to grieve. It's not the same for me. And while it's, of course, not the same, it's different, it is still loss. And it is still the sort of way in which um, processing happens so individually. Like that, you said this before, Kylie, like trauma is so relative. And that doesn't mean, again, because there's not the physical reminders, that there isn't the intensity. But I think it gets shut down in men a lot, and then it comes out in other and different ways.
And then here's just some more, reasons why the expression of grief might be delayed. And we talked about societal pressure and like men being less emotional and not expressing their feelings, um, and the stigma, right, that exists. I mean, I think there's stigma around grief in our society in general, and then you add the layer of being a male in there, where you're expected to be strong and hold it all together. That there's not allowing and validation of your experience. So, looking at now signs of grief and trauma, and at least we were talking a little bit about this earlier, in terms of like postpartum depression. But, and I think most of these we've actually covered. Um, is there anything you want to point out here, Elise?
Do you want to talk a little bit about like the language of being sad or just the like, I'm sad that I even have to be sad, right? That there's a lot of self-blame that comes in, I think, that we miss as signs. Like we in perinatal loss work with women, we really do find that thematically I did something wrong or there's something wrong with me are two common core themes. And I think that for men that's very similar. I did something wrong or there's something wrong with me, right? That those kinds of narratives can be a real thorough line in grief and trauma with loss, like the what if piece of it. What if I had done X, Y, and Z, right? What if I had just been around more? What if I had done this? What if I, all the magical thinking that comes along with having had a loss. Dads are equally having those kinds of feelings and core as well. But again, sometimes it is so masked behind the sort of like irritability or flatness.
And then I just want to bring up affairs only because it's been showing up in my work a lot, of people having either emotional or physical affairs after their rainbow babies are born. Um, and I'm trying to communicate like this is a sign of the trauma and postpartum depression, but nobody's seeing it. Um, and so I guess, like, is there,
Well, I'll sort of ascribe a lot of that to self medication, right? Like self medicating the distress around it, right? We know for so much of pregnancy after loss, there's a hypervigilance, a lot of fear, a lot of anxiety, just, the preoccupation, and that's a lot of distress with not a lot of outlet. And so I really look at affairs, or whether they're emotional or physical, as a way to kind of self-medicate, that it's not a healthy coping mechanism, but it's this sort of navigation in the same way that drinking too much or smoking too much weed or other options in terms of drugs and alcohol. It is trying to lessen a certain feeling or manage a certain feeling that is a symptom of the depression.
and then I also just want to point out on this list, the isolation after loss is really common. It's a really common feeling that I hear from most people. And so I just want to validate that if you're feeling it's really common to feel that way. And um,
Yeah, it's like it's almost a double loss frequently, right? The loss of community, of friends, of whoever you had connected with when you discovered the pregnancy, or you were pregnant, or were in the process of fertility. Like those communities can really just distance after a loss, and that exacerbates the isolation, just as you're saying. But the grief is of course the baby and the loss of the life as you had envisioned for yourself as a parent, but also this community that potentially you had started to build.
and I think in this type of loss, there are a lot of secondary losses, relationships being one of them. Um, and just we're not going to go too much into that, but there are a lot of other losses that happen that we don't necessarily even realize that they're losses. And I think it's like putting language to it and understanding that, yes, there are losses of relationships. There are, whether it be friends who, in general, friends who are pregnant at the same time, family members, people not understanding, things like that. Guilt, you talked a lot about this already. Um,
I think it's worth sort of talking about not grieving in the same fashion as partner, because I think that sometimes this creates a lot of conflict between lost parents, that different people grieve very differently. And depending on dad's family of origin, depending on the witness to what was grieving what kind of grieving was socially acceptable in family of origin, that may sort of manifest in how they're grieving. And again, often because there is frequently that delayed grief, it doesn't always look the same. And I think that even sort of years later, because we know loss can have a lot of reverberation throughout the years, but on anniversaries, let's say on an anniversary of a loss, the frustration that partner or dad is not grieving in the same way, it doesn't mean that the thoughts aren't there. It doesn't mean that the experience isn't there. It just, again, may not be vocalized in the same way as birthing parent or mom. And I think that so often that can show up as a conflict between, you know, and or as a fight between two partners.
Yeah, and then this goes back to like what is normal grieving, and to understand that normal grieving, your grief is individual, and that even if, like, let's say you are grieving in similar ways as your partner, you're not going to be on the same timeline as them. And where one person might be irritable now, the other person's depressed, it could easily shift later on, and you're just not, it's not parallel. And so, not being in the same places, we often judge each other. And with that judgment comes problems, right? Because then that drives you further away from each other. So I think keeping the communication open, really understanding that each person is on their own path and they're on their own timeline, um, is important, and that communicating your needs of, this is where I am and this is what I need right now. So we're not in that talking about what can you do part of the conversation, but just, you know, that is such a huge part of grieving as a couple.
And just to be aware, we're at 9:37 here, so we have about 10 minutes or so.
Thank you.
So
Intimacy.
yeah, I mean, I think again, this has so much to do with different levels of grief. I think you've just said it so well that during the grieving process, each of us are in a different place at a different time, and a lot of that I think manifests in intimacy. And I think the recovery journey is so uh, paramount to how to reconnect in terms of sexuality and intimacy. And sometimes it's frankly about fear, because I've worked with plenty of lost dads whose anxiety really manifests of, well, if we get pregnant again, we're going to have loss again. And that can be a pretty powerful deterrent to intimacy. Or sometimes people really engage in intimacy as like a coping mechanism. So there's no one sort of narrative, I think, that happens between couples and intimacy after loss. But so much of it is like, how do you turn towards each other? I actually think this could be a whole sort of topic on its own, but just worth touching on. No pun intended there, but just to kind of acknowledge that there's a very different journey for each couple, and that anxiety is frequently a piece of this. Yeah.
So what are things that can be helpful? Right, because in a situation where we feel completely out of control, right, of when what has happened to us is out of our control, and not often how we're responding and grieving can feel out of control, what are things we can do to kind of take action where we can? So looking at individual counseling, right, that you're getting your own support for yourself, and that your grief is really being validated and looked at when you're not in a couple situation, right? Like couples counseling is also very important, but having your own space, I think, is essential for both partners in the parents. Connecting with your partner, so that goes back to the communication, like setting aside a time whether this be like, I'm going to set aside a time each day or each week where maybe you do a check-in. Maybe it's your time to talk about your baby that died, that you're like, this is my time to spend with Norbert. Like, we're going to set this time aside to do that. But really keeping talking, because it's easy to shut down, to go into a cave, be hyper focused on what you're doing with work or whatever, you're in survival mode, like, but you need to connect with your partner. Social support. So this is different than a bereavement support group. So the bereavement support group can be very helpful, right? Because it's a container where you're talking specifically about your loss. It's specifically about that. Social support could be family and friends, but they're not always the most helpful. So it's like, in that instance, it's who is there that you can feel supported and safe with to do things with. And it may be that you can't have these hard conversations with people in your normal life. Um, and that just may be what it is. And that's why you find other bereaved parents to talk to if you can. And then some people will really surprise you. I mean, I found that it's like some of the people who were there for us were not the people that I expected. And so just really assessing the situation with each person, and not, and it's okay to say no to certain people if you're just not feeling okay with being with them. And then here's some other ideas, right, that are helpful to anyone when you're just feeling bad and you've experienced something that just shakes your life, right? So like being outside in nature is very healing. Making sure you're exercising. Exercising is helping to kind of move the trauma that's in your body. It helps, of course, by releasing endorphins and other feel-good hormones. So that can help with depression. Making sure that you're sleeping enough. And if you're having a hard time sleeping, which is very common after pregnancy and infant loss, a lot of it's due to like the hypervigilance and anxiety. If you're seeing a therapist, it's not getting better, like ask to talk to your doctor, because you need to sleep, or else it's like a cycle of like not sleeping, not feeling good. And that's just important for you and your partner. And then, when you're eating nutritious foods, you're just trying to like take care. It's like self-care for your body, not drinking alcohol, not doing drugs. Like, these are the things that we may use to self-medicate. They can also, the absence of them can help to just nurture your body. And then setting limits and boundaries with work, because we mentioned that it's easy to be hyper focused on work as a distraction. And so, being intentional about what your boundaries are and how much time you want to spend, and what time can you set aside for your own grieving that's just for you. And knowing that it's not always going to be like this. It's not always going to be this painful and this hard. But when it is, allowing yourself that time and space to take care of yourself so that you can be there for yourself, be there for your family, things like that. Is there anything else, Elise, on that?
I mean, I would just add sleep hygiene is a really big piece of it, right? I mean, we really use social media or news or television, Netflix, etc., to cope for distraction, and they're really wonderful distractions. But sleep hygiene is so important, meaning 2 hours before you'd like to go to sleep, you got to shut down all the screens. And whenever I talk to clients about this, there's like, that's sort of near impossible. But brick your phone, turn the TV off, read a book, that is completely unrelated. I think read a magazine that's completely unrelated, meaning sometimes with fiction stories, we can often be taken off guard, for example, if some sort of loss comes up, and just being aware of that as the trigger. The other thing that I would add is have a list of things that normally you might do around the house and make a checklist and stick it on your fridge, because so often people do want to help but don't know how. So if you do have friends or family who are there or coming by and say, "What can I do? Is there anything I can do?" That's such an impossible question to answer when you're in grief. So referring them to the list on the fridge, and even if it's like they take out the trash or they give the bathroom a wipe down or they throw a load of laundry in, people do want to do things like that. It helps them feel like they're contributing, and it's one less thing for you to do, and you also don't have to answer that question.
And I think when dealing with other people in that manner, right? They're asking, "What can I do?" People in our society need to be educated about what you need, right? And you're going to be different from me or Elise or whoever. We're all going to want to be interacting with people in different ways, but you need to express like what you and your partner need at that moment, and it can change. We also have a whole section on our website devoted to family and friends, and that's a great thing to send them. Like, send them the link to that section of our website so they can read about the loss. They can read like what to say and what not to say. They can read about how to support you, so that you don't have to tell them. You may not even know if you're especially if you're in the beginning, you don't know what can be helpful. And so sending them that might be helpful as well. Um, and I also wanted to add in here, there is, Elise mentioned this, there is a panel discussion of fathers that we did last month. So it's called A Conversation with Bereaved Fathers. It's also on the website in the webinar section. That might be helpful for you to watch. So it's 4 fathers that are just talking about their experiences of loss. And I think that you might enjoy that. So I think that is it. And we're just going to open it up to questions now. Um, so if you have a question, I just encourage you to type it into the chat box and we will try to answer it for you. And while people are thinking about what they want to ask, I want to say thank you to Elise for volunteering her time to be here today to talk about this important subject. Elise is a member of our clinical advisory board, and she's been such an amazing support throughout our whole journey of becoming a nonprofit and working with parents and providers. So thank you, Elise. And I also would like to just say that we are a nonprofit organization and rely on donations to be able to provide free resources and programs and services. So if you found today helpful, if you would consider making a small donation on our website. So I'll put that into the chat box as well. So one question from David that came in says, what should fathers be looking for finding an appropriate professional for one-on-one counseling?
So I'm going to say this is, I want to answer this as honestly and as frankly as possible. And I would say it's a little bit tricky. And here's why: because marriage and family therapists, professional counselors, psychologists, none of their licensing boards mandate that they get training in perinatal mental health, so preconception to 1 year postpartum, and that includes loss. So, PSI has a directory, Return to Zero has a wonderful directory. What I would also say, so knowing all of that, there are some resources, may not necessarily have training for dads, but really we know that the thing that works the best as therapists is when you feel comfortable and confident in your provider, right? So if you have a provider that you feel like you can talk to, that's going to be the sort of most important thing, whether it's you like the look of their website or when you talk to them, they feel like they have a good vibe. It is who are you most comfortable with? And even if they don't have the education in perinatal mental health, you can always send them to RTZ. It's really about who do you feel so comfortable with.
And I'm putting some links in the chat right now. So I'm putting the link to our pregnancy and infant loss directory. I put a link to the webinar with the panel discussion with fathers as well. And if you're watching this um, as a recording, that I will send this out in the email as well. So okay, so Anna is asking, how can we encourage dads to seek help when they feel so triggered by the trauma and don't want to relive it? Is it best to let them grieve at their own pace and support them until they're ready to ask for help?
Well, look, I mean, I think it's about screening, and so much of encouraging dads to seek help in this realm is about having very open and welcoming and inclusive, both sort of visuals and materials. I think frequently a lot of birthing communities or birthing loss communities are not very welcoming to dads, and not intentionally, just more in that there aren't things like seeing themselves reflected in any of the organization's materials. So I think the first piece is to kind of take a look at, like, as an organization, or when you're looking for an organization for your partner, do they have a sort of more inclusive and equitable profile so that dads can feel comfortable and welcome there? In terms of being triggered by the trauma and not wanting to relive it, which is part of, the answer to that would be it's kind of no different for men and women in that sense, which is everybody again is going to grieve and seek support at their own pace. But Kylie had mentioned this, that we know that dads, the onset for paternal depression is usually about 3 to 6 months post, uh, like I would say even post loss, right? So it's not necessarily going to be, the week, the 2 weeks after, when they're in this sort of very goal driven, how do we just get through this mode. It is, how do we continue to check in later on, right? So maybe it's 3 to 6 months later, yeah, they're screening or checking in or saying, I really understand that you're not in a place right now where you're wanting to have some extra support, but I really want to share these resources with you so that when you are ready, they are there. And even going back and saying, hey, I'm just checking in again and wanting to remind you that there are options, and there are options where you will be understood and only have to talk about it in the way that you would like to. I hope that answers that question.
Yeah. I think that's helpful for anyone who's suffering. Like, if they're not ready at a specific point, continue to remind them, because they may not remember, right? Like, remind them that there are resources, there is help. And yeah. Okay, another question is, can you talk about the feelings that arise associated with needing a break before conceiving that may not align with your spouse? So maybe one person's wanting to try right away and the other person's like, hold on, I need to process this and I need a break.
Yeah, I mean, again, that's a very tricky question, where it is so much about how do the two of you communicate, right? And again, it goes back to that everybody has such a different timeline. And I don't, when you say feelings, maybe I'm thinking that there's some contention between partners about what is an appropriate timeline. And I think maybe a way to navigate it would to say to a partner who's wanting to try, look, we have very different timelines. We're grieving in different ways. I think I do need a little bit of understanding that my timeline is not the same, and I truly understand how you are really ready to move forward. And frankly, in that case, I might recommend couples therapy, because I think it's about figuring out, how the two of you can give each other the opportunity to grieve. And yet, if there is still a sort of more goal directed creation of family, that may need some additional support. Um, it's a tricky one, right? I mean, everybody has such a different preference. I want to get pregnant again right away. I think that'll be a rehealing experience, or I don't want to do that. I'm afraid. I think sometimes too, depending on, well, I'll end the answer to that question there. I'll pause there for a sec.
Yeah. Now, so does anyone else have any questions? Brian says he agrees with you, Elise, on materials given out like at the 3 to 6 month time, that in the hospital, everything is kind of a blur.
Yeah, and I think this is where men fall through the cracks, because they don't necessarily have any interaction with any providers at that point, right? So, if there's hasn't been an opportunity for individual therapy or couples counseling or group support, and frequently women may have a follow-up checkup with their OB, or if they're engaged online or something like that, they more frequently will have interaction with the system, who will do some sort of screening or checkup, and men frequently don't. So this is sometimes where I think as organizations, it's helpful to brainstorm or have sort of that follow-up care. I mean, frankly, my fantasy of this is that for every grieving family, there would be those follow-ups at 3 months and 6 months and 9 months. Like, wouldn't it be wonderful if there were programs that would be able to reach out to families that have experienced loss and said, hey, we just have an opportunity for you to chat with a counselor 15 minutes or so, and just to do both a screening and referral if needed. One day.
I think that's all. There hasn't been any more questions that came in. So I want to thank everybody for being here today. And hopefully that you found the information that we talked about helpful in your grieving journey. And, I encourage you to visit the website, and there's a lot more information on there. Information, resources, webinars, support groups, that type of stuff that you can find on our website. So thank you all. And I just send all of you love who are grieving your babies. Okay, thank you.